Hi Facebook community, it's Ashley from Munawar and Andrews-Saltillo or MLaw firm. We're back today to talk about some of the issues from one of the articles we posted this week. We posted an article about nursing home negligence. We saw a lot of traffic, a lot of comments, and a lot of people concerned for their loved ones. So today what we're going to go over is 7 different signs that your loved one is being abused and neglected in their nursing home. So we just want to make sure you're looking out for these things. So let's start. 1. Personal hygiene. Are they being bathed? Are their nails being clipped? Are their teeth being brushed? These are all things that are part of a nursing home's responsibilities. They have assistants, they have nursing staff that take care of all of these things. If your loved one is being treated inhumanely and these things aren't being done, that's actionable. You need to call us and you need to let us, an attorney, know, and you need to make sure and to advocate for your loved one to make sure they're being taken care of. 2. An unsanitary living condition. That means their sheets aren't being changed, their room isn't being cleaned. Not only is this unacceptable, this can lead to more injuries. If the floors aren't being washed and the floors aren't being kept clean, they could trip and fall and hurt themselves. If they're laying in dirty bed sheets time and time again, and if there isn't a standard of cleanliness in the facility to begin with, we could have issues with bed bugs and infestations. Again, these things are unacceptable for your loved ones that you've chosen to put into a nursing establishment to being helped. These are signs of neglect and need to be acted on. 3. Malnutrition. Malnutrition is a big deal. Are our loved ones being fed? Are they eating? Are they giving the right amount of food? Sometimes weight loss can, point to other issues. It could be an internal, medical issue. It could be because our loved one is aging and has less of an appetite. But sometimes it could just be outright that they're not being given food. And that's something that's unacceptable again, and it is a form of neglect. So make sure that your loved one is being given meals and eating. 4. Lack of mobility. As our loved ones get older, they're not able to get around as well as they could. But laying in a bed all day can lead to something called bed sores. Bed sores are a type of pressure sore that affects the body when it's not being moved around. If the body isn't being moved, and they can develop these sores, which need to be treated with medical attention, and these are unacceptable on any level. If you have any type of bed sore, your loved one has any type of bed sore, these need to be treated, but this is a clear sign of neglect. That means they're not being moved, they're not being turned, they're not able to get up and be mobile. These are unacceptable, and these by the nursing homes and by the nursing staff, they have rules and regulations about turning the body of your loved one, making sure they're in different positions during the day to make sure that these do not develop. 5. Bruising. A lot of our older population are on blood thinners and on medication that sometimes can lead to bruising more easily than normal. However, why are your loved ones getting bruises? Are they being harmed by staff? Are they being abused? Are they being physically attacked? These are questions you might want to pose with your loved one if you do see bruising that's out of the ordinary. 6. Involuntary seclusion. Involuntary seclusion is where your loved one is being kept apart from the staff, apart from the other nursing home residents, and is being kept alone. This is a form of psychological abuse and is unacceptable. They need to be going around, talking to other people at the home. They should be able to socialize. Being kept by themselves is unacceptable. Again, this is something you'd have to find out by asking, but these are questions you should keep in mind when visiting. 7. Emotional and psychological abuse. This one is important because at a tender age, when our loved ones get older, we send them to nursing homes not only for the medical care they need, but also the physical and emotional care that they need. And psychological abuse can happen if they're being yelled at, if they're being blamed, if they're being ignored by the staff. That's not what a nursing home is about. Nursing homes are supposed to support and love our elderly to make sure that they are in a comfortable environment. If they're being targeted, if they're not being treated correctly, these are all things that are actionable. Now, what you should do is ask your loved one, is anyone yelling at them? Is that anyone speaking to them in a not nice manner? And also when you're there, look at the staff. How is the staff acting? Are they okay? Are they nice? These are all things that are super important when, dealing with emotional and psychological abuse in a nursing home setting. So that about wraps it up today for all of the topics we're going to talk about what we're looking for in nursing home abuse. and what you should be keeping an eye out for. But there obviously are an array of different things can happen to our loved ones. So if you think that your loved one is not being treated correctly at a nursing home, give us a call at 212-400-4000. And make sure you check us out at MLaw Firm on Facebook. Again, thanks so much for tuning in. It's Ashley from Munawar and Andrews-Santillo. I will get back to you next week on another topic. But if you guys have any questions about nursing homes, make sure to put them in the comments below, and we'll get to them sooner than next week. All right, have a great weekend. Bye-bye.